Good afternoon, consultants, senior registrars, and medical officers. My name is Dr. Linda. Today, I'll be talking on a topic that is fundamental to individuals, families, and communities: primary health care. Did you know that in Nigeria, 80% of resources are allocated to the tertiary centers, while less than 20% are allocated to the primary and secondary centers? Yet, 80% of the population is seen in the primary and secondary centers, while only 20% are seen in the tertiary centers. This stark contrast highlights a critical flaw in the healthcare system. Primary healthcare is meant to be the foundation of any effective health system. It's the first point of contact for most people and deals with the most common and preventable diseases. From this illustration, you can see that primary healthcare serves the majority. Primary healthcare is underfunded, and then tertiary centers are overwhelmed and misused. And also, primary healthcare needs strengthening. To build a more effective, accessible, and equitable health system, resources should be redistributed. In order to achieve a universal health coverage and improve health equity in Nigeria, primary healthcare must be prioritized both in policy and funding. In order to understand this mismatch or this imbalance between the allocated resources and the patients using these resources, here's what we'll cover today. Introduction, definition, principles of primary healthcare, components of primary healthcare, activities of primary healthcare, outcomes, role of health workers, challenges, challenges for implementing primary healthcare reforms, conclusion, and references. By way of introduction, 80% of a person's needs can be addressed at the primary care level, yet millions lack access. Primary health care is not just the first contact with the health system, it is often the only contact for many. It determines whether a child gets vaccinated, a mother survives childbirth, or a disease is caught early. And in today's world, facing pandemics, inequality, and rising costs, primary health care is not just important, it is essential. By the 1970s, it was clear that millions of people, especially in low and middle income countries like Nigeria, lacked access to basic health care. Diseases that were preventable or treatable still caused high mortality due to poor health infrastructure, shortage of trained health workers, and focus on curative care. 56% of Nigerians lack access to essential health services, with a 44% universal coverage, which is below the regional average of 46% and a global average of 60.3%, according to the World Health Organization Universal Health Coverage Service Index. 6 out of 10 Nigerians still lack access to primary health care services, a situation that is worsening disease outbreaks and increasing out of pocket expenditure. The global challenges and realizations about health systems and inequalities around the world made leaders from World Health Organization and United Nations International Children's Emergency Fund to co-organize the Alma Ata Conference in 1978. They brought together delegates from 134 countries to form a global consensus on primary health care as the foundation of health systems. The Alma Ata Declaration was the most important outcome of the conference, which recognized health as a fundamental human right, meaning that everyone should or is eligible to access health anytime and anywhere without breaking the bank. They also declared primary health care as the key to achieving health for all by the year 20,000 and as the cornerstone for achieving universal health coverage. Definition. According to the World Health Organization, health is defined as the state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. Primary healthcare is defined as an essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost which the community and the country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. This means that primary health care is not just a service at the clinic, it's a system that puts people at the center. It includes everything from health education and disease prevention to treatment and rehabilitation. More importantly, it emphasizes bringing care closer to where people live and ensuring that this care is fair, accessible, and holistic, involving the entire community and system, not just the health sector. You can think of primary health care like the roots of a tree. It's what keeps the whole system healthy, nourished, and stable from the ground up. Principles of primary healthcare. Principles of primary healthcare is the foundational ideas that build the primary healthcare system. There are four principles of primary healthcare according to the Alma Ata Declaration. Equitable distribution of resources. Here, prioritizing areas or groups with the greatest needs, for example, the low-income communities, rural areas, the high-risk populations like the under fives and the over 70s, ensuring that all individuals can access services regardless of their geographic, economic, or social situations. And then to provide for easy access to service for all, put in place funding system that supports equity such as health insurance, incentives for health workers. In this season where health workers are leaving the country, it's necessary for them to be given incentives like increase in salary, health insurance, um, awards, housing, trainings, and anything that can make them stay. Appropriate technology. It must be culturally acceptable and easy to use by members of the community. It should be cost effective, low cost but effective. For example, the chlorine packs used in the purification of well. It should be available and accessible. The bamboo sticks used to splint fracture instead of the POP that is not readily available in the communities. And then it should have clear scientific evidence of efficacy, like the oral rehydration salt used in managing dehydration in diarrhea disease in children. And then promote self-reliance. This technology should be such that members of the community can use it and they can repair it if it goes bad. Support preventive care and early detection, like the rapid malaria test kit and the pregnancy test kit. Community participation. This involving people in every step of their healthcare, from planning, decision making to implementation and evaluating health services. So every member of the community should be involved in their own healthcare. Encourages training and use of community health workers who serve as encourages training and use of community health workers who serve as links between the health system and local populations. So members of the community should be trained as community health workers instead of bringing health workers from another community to work for them or with them. It promotes ownership and sustainability of health programs at the grassroots, and also mobilizes local resources such as labor, land, and funding to support health infrastructure and outreach. So when you involve members of the community, they volunteer their lands, volunteer money, their time, and everything to support the health infrastructure in their community. And lastly, intersectoral collaboration. Health is influenced by factors beyond medical care, like clean water, good sanitation, good nutrition, education, and adequate housing. So by intersectoral collaboration, other sectors are brought into the picture, not just the health system. So this encourages coordination between different sectors to address the broad determinants of health, such as the agricultural sector, the environmental sector, and also social conditions. They help monitor resources and expertise from various sectors. Also, support policies that create healthier environments and social conditions, such as the health in all policies approach. The health in all policies approach is like a government intervention where medical considerations is taken into consideration in making policies. Importance of primary health care. Of course, we know that primary health care is the cornerstone of a well-functioning health system. No health system functions without primary health care. Its importance lies not only in treating illness, but also in promoting the overall well-being and preventing diseases. The importance of primary health care therefore includes cost-effective care, health education, improved health outcomes, enhances health equity and social justice, reduce hospital admissions, increase patient satisfaction, community empowerment, and continuation of care. Components of primary health care. The components of primary health care are the building blocks or essential elements that build the primary health care. Based on the Alma Ata Declaration, the eight components or elements of primary health care include health education. Here we promote healthy lifestyle and prevention, counsel patients on lifestyle modification, and prevention of common diseases. Nutrition, when ensures food security and proper dietary habits, teach them how to wash their hands before and after eating, how to wash their hands after using the bathrooms. Safe water supply and sanitation. This prevents waterborne diseases and improves hygiene. Waterborne diseases such as cholera. Maternal and child health care services from antenatal to intrapartum care to postpartum care, safe delivery, and child immunization. And then also immunization protects against major infective diseases like tuberculosis. Other components or elements of primary health care include mental health care, oral health, eye care, and non-communicable diseases. They are also a component of primary health care, but they are not amongst the components mentioned in the Alma Ata Declaration. Activities of primary health care. Activities of primary health care includes training and retraining of health workers. This is very important because you need to equip these health workers, especially at the community levels, with the knowledge, skills, and tools necessary to deliver effective, up-to-date, and compassionate primary health care. So even when you have the tools or the facilities in the primary health care, you need trained workers. Referrals. Referrals is very important in primary health care as it's the process of directing a patient from a lower to a higher level of care for further evaluation that cannot be provided at the primary level. Importance of referrals in primary health care therefore includes it ensures continuity of care, it protects patients' health and safety, it strengthens the health system, promotes by promoting a well-functioning third care structure, and optimizes resource use. Health promotion. Here, conducting outreach programs on hygiene, nutrition, and disease prevention, especially in the community level. Disease prevention, screening for common illnesses and providing vaccinations, screening for common illnesses like diabetes and hypertension, and then treatment of common conditions such as malaria. Community mobilization, empowering communities to take ownership of their own health. They should be involved in decision making and everything that concerns their health. Surveillance and data collection. Here, data is gathered data is gathered to monitor disease patterns and trends, to monitor disease outbreaks and epidemics. It also used in planning, early warning, and resource allocation. Emergency response. This may include early detection and reporting of diseases and outbreaks, first aid and basic medical emergency care, disease outbreak management, community awareness and preparedness. Rehabilitation services. This helps patients recover and regain functionality after illnesses or injury. And then provision of essential medicines and supplies. This ensures continuous access to basic, safe, and affordable medications, provision of analgesics, provision of basic antibiotics. Outcomes of effective primary health care. The outcomes may include reduced mobility and mortality. When everything is put in place, when the principles of primary healthcare are practiced, the components are put into place, and the activity of primary healthcare adhered to, of course, there will be reduced mobility and mortality. This also is seen in early diagnosis and treatment, chemoprophylaxis such as anti-malaria in sickle cell disease patients to prevent recurrent or prolonged crisis. It also reduces risk factors of diseases. Regular medical checkup and appropriate counseling for high-risk patients. Regular medical checkup will reduce incidence of complication of hypertension, and also people who are hypertensive will be caught early and medications commence on time to prevent complications such as cardiovascular disease and cerebrovascular complications. Reduce healthcare costs. The use of social health insurance to defray costs, and then to develop community health insurance, thereby the out-of-pocket expenditure is reduced. Develop sustainable and accountable health system. This is um, this is done in such a way that we're able to function effectively over time with available resources, and then a transparent, responsive, and responsible to the needs of the population. The role of health workers in primary health care. Health workers are the backbone of primary healthcare. Primary healthcare cannot function effectively without the healthcare workers. They serve as the direct link between the health system and the community. The health workers that are involved in primary healthcare includes the community health workers, the environmental health officers, the nurses and midwives, and of course the family physicians. The community health workers, also called the CHUs, function as to provide basic prevention and curative services. They help in first aid, they administer vaccines, they are the link between the community and the health system. They help navigate health system from one level to another. Community-based surveillance, they report cases of disease outbreaks. They follow patients up in their homes and ensure drug compliance and adherence. The environmental health workers function to in disease prevention and control. They also help in health education. They go to the community, counsel patients on hygiene, water hygiene, sanitation, and also food safety and hygiene, waste management and pollution, occupation and housing health, health education, and community engagement. Nurses and midwives. The role of nurses and midwives in primary healthcare cannot be overemphasized. They provide direct clinical care and diagnose and treat minor illnesses. The nurses also help in maternal and child health services from the antenatal to postnatal to intrapartum and immunization. They also help in health promotion and education, community outreach and home visits to patients who are on management for chronic illnesses. They help in emergency and first aid services. They help to coordinate care and they help as advocates. They help to advocate and empower community. This is a picture of a community health worker administering vaccine to a child. Role of family physicians. Family physicians are very important in ensuring an effective primary healthcare system. Their functions include comprehensive care. Family physicians diagnose and treat a wide range of illnesses across all age groups, across all genders. They manage physical, psychological, and social aspects of health. They help in continuity of care. They build long-term relationship with patients and families. Family physicians monitor patient progress over time and adjust their treatment plans where necessary. They also help in family and community focus. They consider family dynamics and environmental factors in care, not just diseases. They also help in health promotion and disease prevention, provide counseling on health, lifestyle modification. They conduct routine screening against chronic illnesses such as hypertension and diabetes. They also coordinate referrals. They refer patients to specialists when advanced care is needed. They also help in the health system support. They participate in policy development and health system management. They collect data for surveillance and health planning, and also training and mentorship. Family physicians supervise and train junior doctors. They supervise nurses and community health workers. They teach them how to manage minor illnesses and how to make diagnosis and refer patients to the appropriate center where necessary. They also share their expertise in clinical decision making and ethical practice. What are the challenges for implementing primary healthcare? Implementing effective primary healthcare, especially in low and middle income countries like Nigeria, faces numerous challenges. These issues affect accessibility, quality, and sustainability of primary healthcare services. The first is inadequate funding. From the chart we saw earlier, see how the resources are allocated inappropriately. So inadequate funding, limited government budget allocation to primary healthcare services, the budget more to places where we have less patients, and also insufficient investment in infrastructure, equipment, and drugs. Two, shortage of health skilled or skilled healthcare workers. Most primary healthcare are understaffed. Some places you don't even see a health worker or a doctor at all. Then weak health infrastructure. This is usually due to poorly equipped health centers with inadequate facilities and also understaffed facilities. Geographic and transportation barriers, long distance to health facilities in remote and rural areas. There are areas where the time it will take them to leave the community to a primary health care, not even a hospital, to primary health care may take hours. Most of these patients get tired and will just prefer to stay in their local communities and die. And then by the time they finally take them to the hospitals, the case is complicated and they may not be able to salvage the situation. Poor health information system. This is due to lack of accurate health statistics for planning and decision making. Cultural and social barriers. There are still places where they have traditional beliefs and misconception about modern healthcare. This prevents people from accessing care even when it's available. Poor governance and policy implementation. This is due to lack of political will and weak leadership in health planning. Primary healthcare reforms. So the primary healthcare, the reforms are the deliberate actions taken by the government to help improve the healthcare system. The World Health Organization 2008 proposed reforms are policies and structural changes aimed at improving the accessibility, quality, and effectiveness of primary healthcare services. It ensures that quality care is accessible to all, especially the most vulnerable. Is essential for achieving universal health coverage and addressing emerging health conditions or challenges. It's also critical for building resilient, inclusive, and efficient health systems. Reforming health systems to address equity through universal health coverage, service delivery by reorganization to make health system people-centered with primary care addressing their needs and expectations, not just the disease itself. Leadership reforms to make health authorities more reliable and leadership more participatory and inclusive. So if we have more doctors and more health workers in decision-making places, maybe corruption may be reduced. Public health reforms to promote and protect the health of communities by integrating public sector policies with primary health care, just like the health in all policy I talked about earlier. In conclusion, primary healthcare physicians drive the provision of primary healthcare services in many countries and are often the team leaders. Hence, the need for them to understand and apply the key principles in delivering health services. Universal health coverage is achievable. Investing in primary health care is essential for achieving universal health coverage and improving public health outcomes. No one should die or suffer because they cannot afford or access health care. These are my references. Thank you.